Fracture clinics here, before we started this change, used to be really busy, and I think in most hospitals we'd be seeing up to sort of 80 or 100 patients every morning through the clinic, and that doesn't give you a lot of time to see patients properly and give them the time that they really need.
The aim of the virtual fracture clinic was to give us a better idea of who's come into our clinic, so we have more control over the patients coming in. But equally, not every patient who's seen in an accident and emergency department or a minor injuries unit, they don't all need to come to the clinic. They can perhaps be given specialist advice over the telephone based on a consultant plan.
The implementation of the new virtual fracture clinic process was brought in through a phased approach. The first phase, we had a new minor injuries unit that had opened up to the east of our hospital, and we set about doing a trial with them, which we did for several months, and we learnt quite a lot from that. And then we brought our local minor injuries units that we work a lot with closely now in the January, and then 3 months after that our A&E department came on board, so it all happened within less than a year.
It was quite a big process change from the Royal Berkshire Hospital point of view. It involved a big change with our emergency department and how they booked patients, and equally we also see patients from minor injury units. We have the consultant who reviews all the paperwork and also sets out treatment plan and diagnosis, so that was the main change for us.
The virtual fracture clinic here runs every morning, and what happens is we see between 30 to 60 patients virtually, so all their x-rays and their images and their histories are reviewed by the consultant and the specialist nurse in the clinic.
You can record the diagnosis and the treatment plan directly from the consultant, so the doctors in clinic are able to access that information really quickly and really easily.
From this assessment we can then generate template letters, in which half the work is actually done for us.
Bluespier's had a big impact on the way that we work, particularly from the administration point of view. So beforehand we were having to hand type all our letters from templates, whereas now the information demographics automatically populate through from Bluespier, so that saves an awful lot of time. Patients seems to really like the service, and they have orthopaedic nurses who they can speak to on the phone, get any advice that they need, any questions that they thought, oh, I really should have asked that. They can ring back and just ask their questions, so it's a really good point of contact for patients. We're able to plan their treatment and we know exactly why they're here, and they come at the right time into the right clinic.
So implementing the virtual fracture clinic process does take a lot of planning, and that planning needs to happen early on so that your minor injuries units and your ED departments are on board so that the process can run smoothly.
The most important is actually to go and visit a unit where it's up and running and working well, and we're very happy to have visitors here to the Royal Berks. John Morley, one of my consultant colleagues whose original idea to set it up here, took a team of specialist nurses and managers up to Glasgow to see how they ran the service there, and got a vast amount of information that they could bring back and help to set up our service.
Equally, you do need a system like Bluespier to aid the process so that you can speedily get through the patient, so there aren't delays with their information going out to them. And also, if a patient is coming to the clinic the next day, the assessment documentation is available for the clinician to review the patient with.
It's really improved the way that we work here at the Royal Berks.